So with that large introduction, let's look at your data. And I'm actually going to be done by 10, so a little over 15 minutes. So the first page is really demographics. If you look at the comparison, I believe that in your packet you can compare this time to the data that you saw in the first round. And for the Healthy Worksite initiative, the total group, the ages are very similar. The mean age was 45 in the first round, 44 in the second. Again, it looks like this is the same group of people that showed up, so this tells us it's a very representative group. The first time through was 74% female in the population. Last time it was 76%. Same percent, same issue.
But Scott, are the numbers that they're new?
Yeah.
That's not.
So right.
Those are new folks from who participated in the first round.
So what we have, the numbers I'll be giving you, is in the first round, the data from those people that showed up the first round. Then secondly, the people in the second round that were new, and we're calling them cohort 2.
Cohort 2.
Unduplicated.
Unduplicated. They didn't show up the first time. They showed up for the first time in round 2. Lab and physical measurements. Do any of you see any big difference in the lab and physical measurements between cohort 1 and cohort 2? So I'm going to take that as a no. Are you able to find that in your packet?
Scott, do you want to hold up the page that they would find that information on?
So you find lab and physical measurements.
It should still all be just in the thick packet.
Right, in the thick packet.
And what we did was we put, it'll say at the top, December 2008. That's the new unduplicated cohort 2. And then right behind that, you'll see June 2008.
2 pages.
And that's the new people who participated in June. Just to give you a bit of comparison. And the other thing is we realize that there's not a lot of time for this because I think you guys are going to need to take back and soak this in. You will have more opportunity for questions ongoing.
And this is fresh data. Meaning we just got it this week. During the week, in fact, some of this we just got yesterday. So we haven't had time to look at it really closely, but we wanted to get to you all the data we could so that you could look at it. And what we'd like to do is, if there's enough questions, if we need to go over it again, what we will do is we'll have a phone conference and go through it. So do look at, again, I think it's important to note the differences in the lab and physical measurements at risk by gender. You'll see that there's a different pattern between men and women. And then when you look at the same thing on the survey results, again, it's a different pattern. So the women in the population appear to have a different risk pattern than men. So that may mean that you target differently and that the interventions you do are keyed toward men or women as far as participation. Everybody finding those? In the small packet, like this, there's some new data that did not exist in cohort 1. And yet to come, that we don't have yet, there was a survey embedded in the, there was a group of questions that was in the survey taken by those that had been in cohort 1 and showed up the first time, and then took it again the second time, and we asked them, what did they do with their data? We thought it was really important to find out what did they do. We will have that for you, and we'll get it to you as soon as we can. That report has not been completed yet. And we thought it was very important to find out, people got this data, what did they do with it? Did they go see their doctor? Did they have a doctor? Did they make personal changes? What did they do? I think that will really help us with the second step of, once we give this data to people, helping them to direct folks as to what can you do with it for yourself. So you'll be getting that separately.
Just to be clear, is there a role, or is there a comparison between the June and the December of cohort 1, where the folks
Yes.
that came back and actually retook the screening so we could see that there was differences?
Yes.
It's the short stapled piece,
It's the
4
skinny little
pages.
packet. And it
It's
says,
titled Cohort 1 Comparison Between June 2008 and December 2008.
Good question. So if you look at the question from Kari was numbers. How many people participated? Cohort 1 that were returnees.
Is the number on there? Guys,
And this is where we're getting as fresh data.
Yes, the number is, if you go to page 3, there's a chart that says average change in scores among participants. There's a kind of a yellow gold bar at the bottom. It says total participants. Does that make sense? Those are the people who came back.
Okay.
Did you get
So
it?
that number indicates how many people from the original number 1 came back to number 2. Exactly.
And the definition no, it is all. I know, yeah.
So let's walk through this page, which has blue, red, green, and purple bars. Participant changes in risk factors. The blue is how many improved. The red is how many got worse. The green has remained the same. And then the purple is missing measurements. So you can see that there were some improvements. If you looked at this without understanding what we were doing, you would say, well, you shouldn't achieve much. People either remain, more than half the people remain the same, or had a risk factor get worse. So, did we have a comprehensive program that addressed all the risks? No. Was it one of the goals of this program to have a comprehensive program that addressed all the risks? No. The goal of this program, Healthy Worksite Initiative, was to figure out how we can get actionable data and to try a few things. Now, if the legislature wanted us to have a comprehensive program that addressed all the risks, they would have had to have given us more money. And of course, that is the message we will go back with. We could make changes. We just need more money. So don't think of this as a failure in any way to change all these risks. This is a beginning point. We gathered data. We saw that there's actionable data. We began to make changes. And we really were not aiming to clean up the population risks. We were aiming to figure out what is the process we use to get there. And then it takes quite a while. As Mary said, a group of people that are smokers, what we know in the United States is the early quitters for smoking. We're now down to a group that is more difficult. It's not going to happen this week. It's going to take a while. And maybe in your organization you'll say, that's not where we need to focus, because we have data. We need to focus on physical activity. We need to focus on food intake. We think that our whole population appears to be having a hard time sleeping. So maybe we need to address that.